Welcome to BodyWorks Physical Therapy in Bloomington, Minnesota. Hi, my name is Keith Sullivan. I'm one of the physical therapists here at BodyWorks. I'd like to talk with you today about your fascial system. Fascia is the connective tissue that surrounds and supports every cell of your body. Every muscle, bone, joint, organ, gland, even your brain and spinal cord are surrounded by fascia. If your fascial system gets tight, it can compress your body with up to 2,000 pounds of force per square inch. Just think about that for a minute. It's like having a full-grown Clydesdale horse standing on a postage stamp. This can cause enormous pressure on pain-sensitive tissues in your body, things like nerves, muscles, or discs in your back or neck.
One of the key pieces of our treatment in this clinic is balancing the pelvis. That's a critical piece to keeping the rest of the body in balance and harmony. We spend each session figuring out where that person needs to be more balanced, where their areas of tightness or restriction are.
Our physical therapy clinic is different because we come from more of a holistic approach. We're going to look at your whole body. We're going to bring you into the room. We're going to look at your range of motion, assess your tissues. You know, how well does your tissue texture move?
A lot of health problems most Americans suffer with can be linked to restrictions or adhesions within our fascial network.
I've had some really major medical issues in my life. I've had 3 back surgeries and I went through breast cancer. The good news is I'm here, but I had some real challenges that I was left with, especially mobility. I went to my surgeon recently and he was amazed at the mobility I've achieved.
What we also do is bring people into the awareness of their body. How does it feel? How does it feel before the treatment? Now how does it feel once your tissues have softened and your tissues are released? Feel the freedom of movement.
To get a better idea of what your fascial system looks like, I'd like you to imagine a piece of chicken. See this fuzzy cotton candy stuff between the skin and the meat? That's our superficial fascia. It surrounds our body like a giant stocking from head to toe. Then we have the myofascia. That's the tough clear coating over the muscles. This surrounds all of our muscles, of our legs, arms, back, and neck. Okay, this next layer down is called the core fascia. And that's the fascia that surrounds our organs like a giant gunny sack. It comes up the front of our spine, the front of our neck, and attaches to the bone behind our eyes. So imagine all of your organs being suspended from your temples. So that's how tightness down here in your belly can cause migraine headaches up behind your eyes.
We come from a John Barnes myofascial release approach. Fascia doesn't start releasing for 90 to 120 seconds. That's start releasing. It can take 5 minutes or more to get that full release.
So myofascial release is a whole body approach because sometimes tightness in one area of your body can affect another area of your body. This is what's called a tensegrity model. So imagine this yellow bead here is your right kidney. Let's say if you had a kidney stone and you had scar tissue around your kidney and that started to pull on your psoas muscle, and that knocked your hip forward on the right side, you can see how that could all the way pull almost all the way up to your other shoulder. So again, that's why I try to treat the whole body because sometimes tightness in one area can cause pain or problems in another area far away from the original site of injury.
One of the unique things that we do in our clinic is mouth work. This is a unique approach to balancing the small bones and soft tissues that are within the mouth. And they have a very strong influence on everything in the body as that fascial system is connected. We will individually look at each of the bones, see how they're moving or not moving, treat what's restricted, and create better balance in the mouth, and that in turn creates better balance in the rest of the body.
I met 2 of the therapists at a course, a cranial sacral therapy course that's given by the John Upledger Institute, and I was suffering with my own jaw pain, and I met the 2 therapists that work at BodyWorks Physical Therapy. And so I had to humble myself and decide to get treatment for some pain I was having, and it was the best experience. My pain is gone, and I ended up giving the owner my resume and ended up with a job here. So it all turned out really well. Well, I enjoy treating infants because sometimes you'll have children that aren't rolling or crawling or walking, and then you see them blossom and really see their full potential.
I tried lots of things. I tried acupuncture, I tried massage. I was willing to try anything. So when I came to BodyWorks, I was immediately impressed because every therapist is educated, highly degreed. They were so kind and caring, and not only when I was getting excellent treatment at the office, but I really appreciated the fact that They educated me on things that I could do when I got home to continue my improvement. When I first got here, I could hardly raise my arms over my head. I could hardly lift a bag of groceries. I feel 100% better.
The deepest layer of fascia is the dura. This is the fascia that surrounds our brain and spinal cord. This is the core of the onion, the deepest layer. We also call this the craniosacral layer because it's attached to the bones of our skull, going down to the sacrum and coccyx, or a tailbone at the end of the spine. Tightness in this layer can create a stranglehold over your whole central nervous system, affecting anywhere in your body. With craniosacral therapy, we work on realigning the bones of your skull and spine. We used to think that the bones of the skull were fused. That's been totally disproven. We now know that the sutures of your skull should never normally fuse. There are joints like any other joint in your body. There's like a tongue and groove joint. They should slide and expand and release a little bit. Inside the skull is your dural system. If you ever had an epidural injection, that's what was an injection into the dural tube. So the dura separates your upper brain from your lower brain and your right brain from your left brain. Then it forms this tube that goes all the way down towards your tailbone. The dural system acts like a Chinese finger trap. If you ever played with these as a little kid, you can tell if something gets tight, it'll pinch on the nerves going out to your arms or legs, or pinch on the spinal cord going down your back. The dural system also has what's called the craniosacral rhythm. If you can imagine like the skull expanding like a water balloon for 3 to 5 seconds, and then narrowing for 3 to 5 seconds. There's a pumping action to the flow of the fluid from your brain down your spinal cord, and that's called your craniosacral rhythm. A therapist trained in craniosacral therapy, that's what we're trained in, is to feel where is this restricted, where is it tight, where is it not moving the way it's supposed to. Whether it be just like you can feel your pulse from your heart and your wrist or your ankle, same thing, we can feel this craniosacral rhythm anywhere in the body.
Once you get the fascia released and you get back your fluid motion, then you're going to get better range of motion, better flexibility, your balance is going to be better, you're going to feel better inside.
For me, meeting every therapist, and I had the opportunity to work with every therapist, I was just really impressed. They just seemed to have a very in tune sense about what would help me the most physically and with my body. And you know, at first you're a little concerned, and then, oh my gosh, it's working, which is really great.
I love what I do because I know that these techniques help, and it gives people a happier, healthier life. It makes people feel better, gives them freedom of movement.
Have you ever had an unexplained pain or tightness in your body that just wouldn't go away, or your doctor couldn't find, or a recurrent sports injury that just wouldn't go away? It was probably fascia related. Remember, this tissue surrounds and penetrates every cell of your body. Tightness in one area can travel, like a run on a nylon or a pull on a sweater, and gives you symptoms far away from the original site of injury. The funny thing about fascial adhesions or restrictions is that they don't show up on CAT scans, x-rays, or MRIs. So sometimes your doctor or therapist might just shrug their shoulders and say you have to learn to live with it. The good news is, now you don't have to. There are new techniques that have been developed that identify and treat the fascia restrictions in your body. The miraculous thing about fascia is that it responds to a gentle, sustained stretch. You simply take your hands, gently sink into the tissue, induce a light stretch, and wait. With the fascia, it's not how hard you push, it's how long you push that's important. Here at BodyWorks Physical Therapy, we take the time to thoroughly go through your body, evaluating your whole body, looking for fascia restrictions and imbalances. Our therapists are the leading experts in the state of Minnesota using advanced myofascial release and craniosacral therapy techniques. We spend a full hour one-on-one with you doing gentle hands-on releasing techniques to get your fascia to naturally stretch itself free. This can restore the normal range of motion and alignment of your body.
If you wake up in the morning and you have back pain, or you're cooking and you're standing and your back aches or your neck aches, there is relief for you. There are things that we can do to help.
If you'd like more information about BodyWorks Physical Therapy or the techniques that we utilize, please check out our website at bodyworksphysicaltherapy.com or bwpt.org. Thank you.